there is always the opportunity for someone in a very severe burn to slip into shock. Give us an idea of how that's looked at, registered, when you know that the patient is in trouble, and then what you can do from there.
Yeah. So one of the things that happens is that we usually anticipate these things, and it's one of the things that we've spoken of, the rule of 9, or getting a history of what happened to the patient. We anticipate the patients that we know are going to be at risk. Sometimes we don't get this, but most of the time we have an idea of who the patient's going to be at risk. It's going to be the elderly person. It's going to be the person who has some type of medical condition. And depending on the degree of burn or the surface area of the burn, we can anticipate who's the person who's going to be in shock. So the way that we treat this is it's in a standardized approach. We try to rule out that there's no other cause of shock, because a burn immediately shouldn't cause you shock, at least not immediately. This is something that could occur a couple of days, but it shouldn't happen in the first initial hours. If anything, you expect the patient probably to be more, his blood pressure and everything to be high because of the pain and the injury. So the first thing we will do is assess and make sure that the patient, in a standardized protocol with any type of injury, will go to the airway, breathing, and circulation, which is a standardized approach for someone in the ER. And then once we cover those things and rule out other injuries, then we start looking for the management of the burn. And the reality is shock and low pressure. And a burn really relates to that loss of fluid. The skin, and that's an important function of the skin. It's maintaining your fluid in your body. And you can imagine you're burned. This is open. You're going to drain. You're going to lose fluid. Plus the inflammation that's happening. So we treat this by giving IV fluids. So based on the degree, the dimension of the wound, the surface area, we will calculate how much fluids the patient is going to need. So there's going to be a higher requirement. So we already anticipate and have an idea of how much fluids that patient is going to need before we get to shock. Hopefully, we can avoid getting to shock.